Welcome back to the National Academy of Medicine's workshop, The What of Systems Transformation, Anchoring Health in Climate Action. We'll now begin session 2, Opportunities and Challenges for Transformative Health-Centered Climate Action Across High-Emitting Sectors. I'm pleased to introduce our session moderator, Chris Hanley. Chris is the director of the National Academy of Medicine's Climate Grand Challenge. Chris, over to you.
Thank you, Michelle. Hello, everyone. Hope you had a chance to get a quick stretch in. Thank you for joining us for our last conversation of the day. Opportunities and challenges for transformative health-centered climate action across high-emitting sectors. And as we heard in the previous session, high-emitting sectors play a decisive role in shaping the future of our climate and, critically, the health and well-being of population around the world. If we're to achieve truly transformative climate action, health cannot be an afterthought. It has to serve as both an anchor point as well as a strategic lever to drive systematic change. Now, we know that bold systems-level action will require unprecedented collaboration across sectors, across geographies, and across economies. Take, for example, some of the recent successes, including how cross-sector collaboration on air pollution between health agencies, energy providers, urban planners, and environmental regulators has helped to drive cleaner air policies around the world. These efforts show what's possible when diverse sectors rally around a shared health imperative. At the same time, we must be mindful that challenges and opportunities that each sector faces are not uniform. They are shaped by the economic, geographic, and social realities of different regions and communities. So, to advance health-centered climate action at scale, we need a clear understanding of both the common barriers we share, as well as the unique dynamics that we must navigate together and separately. So with that, I'm excited to turn it over to our session, and here's how it will flow. First off, each of our panelists will offer brief framing remarks, sharing their perspectives on how health can be better integrated into their sector's climate action agenda, and where they see key opportunities and challenges ahead. We'll then move into a moderated discussion. Building on these insights, we'll explore where there's alignment across sectors and how we can foster stronger cross-sector collaboration towards a future of health for all at net zero. And finally, we'll open the door for your questions and reflections before wrapping it up with some key takeaways and recommendations to our commission. So with that, I'm going to kick us off with our first speaker, who we have Adina Renee Adler, who serves as the executive director at the Global Steel Climate Council, representing the heavy industry sector. So with that, Adina, I'll turn it over to you.
Great. Thank you so much, Chris. And thank you to the National Academies of Medicine for the invitation to contribute to this work. If we can advance to the next slide, I can dig right in since I only get 5 minutes. You know, the steel sector has been thinking about climate change and making a positive environmental impact for decades now. And, you know, this idea of making it a commons, a common effort of all of us to really try to find solutions to how do we tackle this common problem is something that we have been seized with for a long time, and we're quite advanced. And there's a lot of opportunities that we have already been trying to deal with for a long time. And I'm delighted to provide some ideas on how we can work together to get there. Now, my organization, the Global Steel Climate Council, is actually a young organization, but it doesn't mean that we're young because we're only thinking about this in a short amount of time. The companies themselves individually have been working on this for a long time, but they realize that there's so much more that they could do when they come together and think about it as a group. So we're a coalition of steel producers that are making not just a commitment through pledges, but to take real action to cut even more emissions in the steelmaking process. And we have created a standard of emissions calculation, reporting, and verification methodologies through corporate-wide action, as well as declaring the emissions intensity of the products that they're putting out into the marketplace. Next slide, please. The reason that they are doing this is driven by the markets. It's driven by government policy, laws, and regulation. And then there's that combination. Market-driven is how businesses are motivated every day to stay in business anyway. It might be through healthy competition with their peers within the marketplace. Maybe it's the drive of their customers, and the customer could be all of us that are just consuming goods every day, but it also could be just, for a steel producer, it could be an automaker who needs steel to make the automobile itself. The efficiency gains that come from technology development, where you can make a product more efficient, which cuts cost, and then you might have a gain in the marketplace. And when you cut costs, that means you might want to make more products, and you do it more efficiently, and you make more goods, and then you want to do it more. And when you have those sort of cost considerations, you might have other positive gains from that. And one of the things within the steel industry is about 60 years ago was the creation of a brand new technology to make steel that ended up not just being more cost competitive and being more efficient, it had a positive environmental outcome, which was less greenhouse gas emissions coming out of it. It could be legally driven. We're seeing this particular, and by the way, the market driven is what we see in North America, where you have, in North America, we have the greenest steel being made here because of those market drivers. In Europe, it's a little bit more legally driven, where you have government regulation putting pressures either directly on the steel industry or indirectly through the way an automobile is made. And then, the steel has to be more sustainably sourced. And then that is putting pressures on steel companies to make sure that they are producing the steel in a more sustainably, more with less emissions. And then ergo, we're driving, decarbonization in that way. And then you can have a hybrid where it's both market driven and legally driven. And then you have those peer pressures as well. In Asia, for example, we don't necessarily see the market driving decarbonization. You don't necessarily see laws that are driving it, but you do see companies realizing that if they want to compete in the global marketplace, they probably should think about creating efficiencies in the steel production process, which means that they, maybe need to cut emissions in some way. So, all of this taken in combination means that we're driving down emissions. But I do want to take note that even if a steel producer isn't thinking about cutting emissions for purposes of creating positive health outcomes, they have been a leader in the heavy industries for decades in thinking about health and safety for their employees, because they care about their employees. Employees live in communities. It's important to take care of the people that work for them, so that they can continue, so that their people can continue to create positive change within the community so that they can provide for their families. But there are opportunities, of course, where you can create system change, that it's not just about creating healthy lifestyles, but how do you think about that in the course of the fight against climate change? So that's my opening salvo, and I look forward to a more robust discussion about this.
Thank you so much, Adina. Next up, representing the building sector, we have Ommid Saberi, Global Lead for Green and Resilient Buildings at the International Finance Corporation.
Thank you, Chris, and hi, everyone. I want to bring two angles to this conversation from the building sector. So I work in building resilient and green buildings. The two angles that I want to bring to your attention is that the health sector actually is one of the largest consumers of energy globally. And interesting enough that the sector has been less sensitive to efficiency of the resources when it comes to energy, water, and materials use. And that really drives a lot of emissions. At the same time, it increases the cost of operations. So why this matters? Because, I'll give you one example. I was talking to one of the operators of hospitals in in Egypt. And when we did the calculation of the cost of operation, they were paying $50,000 per month for their utility bills. And I simply said, if we save 20% of your utility costs, it would be $10,000 per month. What can you do with $10,000 per month? And he said, I can hire more nurses and more doctors to work for me rather than paying for utilities. And that's really the key element for us, right? So it's really important within this program, within IFC, what we have developed, we developed a program called EDGE that delivers energy efficiency, water efficiency, and materials efficiency. And it gets the assets, they can review their assets, they can find solutions to save energy, water, or materials, and then they can certify those assets. This project has been done in 118 countries with large uptake, and we have many healthcare providers that are adopting this program. But it's not a natural element for them. It feels like that this is not too important for their business. But I think it's really important to bring the quality of health with the element of efficiency. This has other core benefits like reducing air pollution. It has benefits for better service and better healthcare. Let's go to the next slide, please. Alongside with EDGE, what we have also developed is another program for improving resilience to climate change impacts. We have been seeing that the flooding, the high winds or hurricanes, and all other types of natural disasters are happening more and more. And healthcare sector is critical to operate after these events. What we have seen, for example, in Turkey, after the earthquake, many of the hospitals were destroyed. The places that people were looking to take help in. And that's really important for us to also look at resilience of our assets and see whether our assets are resilient to natural disasters, and also they can operate after any disasters. So this program provides a solution to assess and verify all the assets from sites, building foundation, structure, facade, mechanical and electrical systems, and then with trained engineers to assess these projects and see where are the issues that needs to be either for new builds to be improved or for existing building to be assessed. And those two programs, one would help on climate change mitigation, and the second one will help on climate change adaptation, and they together can support. As Adina mentioned around the steel sector, for example, material selection is important, system selection is important, and the design and construction is important. Let's go to the next slide. So this program for resilience is being used globally in different regions and different countries. We are talking to insurance companies, we are talking to the financial institutions to support providing better insurance for the properties that are well designed and resilient. But also we want to link it to the investors that invest in this sector, they can identify these good practices and provide better investment for such assets. The link is up there, and we will be happy to discuss in more detail if you have interest in improving efficiency of your system or resilience of your system. Chris, back to you. Thank you.
Thank you very much, Ommid. Up next, we're going to turn to Michael Replogle, who's the founder emeritus of the Institute for Transportation and Development Policy. Michael, over to you.
Thank you very much. If I could get the next slide, please. So transportation has a profound impact on health, and incorporating health into transportation policy and decisions could have a profound impact on our future climate, environment, and well-being. Traffic safety, 1.3 million people a year are killed in traffic. It's the leading cause of death worldwide in people aged 5 to 29 years old. Physical inactivity contributes to over 3 million deaths a year globally. Traffic emissions contribute to respiratory and cardiovascular disease, and to over 4 million deaths a year that are due to outdoor air pollution. And transport accounts for more than a quarter of total greenhouse gas emissions, with all of their concomitant health impacts. The remedy for these health issues is really, to boil it down to a single answer, is to build dense mixed-use cities that are focused on public transit and active transport with electrification of most elements of the transportation system. The graphic that you see here is based on a study called the Compact City Scenario Electrified, that was done by the Institute for Transportation and Development Policy and the University of California, Davis, about a year or two ago, and looked at 4 scenarios. Business as usual, in which all of these adverse indicators, as well as economic adverse indicators like congestion and the like, continue to go up. On the next, over on the right of the screen, you see a second scenario in which we try and electrify the total transportation system. And this cuts our greenhouse gas pollution, but it also leads to increased sprawl, health, and congestion problems. We still have, while we get some benefits for health, we still have a lot of problems left over for congestion and other adverse impacts. And our greenhouse gas reductions are not nearly as great as they could be. If all we do is make more compact, walkable, bikeable, transit-oriented cities without electrifying, we can also get substantial reduction in greenhouse emissions from business as usual, but we don't optimize the performance and well-being of our economy and don't maximize the health benefits that we get. If we combine electrification with active transport, better public transport, and denser cities that help people meet more of their travel needs by walking, cycling, and transit, then we get the maximum benefits in terms of health, greenhouse reduction, and it also reduces costs the most, because more compact electrified cities, in fact, cost a lot less in terms of both user costs and societal costs and the need for investment. What we looked at in this scenario analysis report was how to shift investment flows in different kinds of transport to obtain these different scenarios. What are the implications? If I could get the next slide. So achieving progress, I think key is to integrate health metrics into transportation policy and to center those objectives as we look for making better decisions at both the small and large scale in how we invest in transportation and the technologies that we support and how we appraise projects. We need to enhance collaborative governance, regulation, and capacity building across different kinds of organizations. We need to build education and awareness and really shift culture to favor a rights-based approach to protection of health and the environment, and to help people understand the connections between those things. We need to get the prices right, the incentives right, so that we can achieve technology innovations that give people better transportation choices and enable them to lower the costs of how much they have to spend to obtain the mobility that they need to meet their daily lives. We need to manage the transition both on the energy side and on the automation side in a way that expands shared mobility options and enables people to live good lives with less costs for mobility. And we need to communicate effectively and strategically, especially in populist contexts, focusing on safety, resilience, smart system operations and management, how we can lower mobility costs with these sustainable choices, and how we can also boost mobility and access, especially for children and their mothers. These are the kinds of approaches, I think, that can carry the day when we're faced with right-wing populist approaches to dealing with transport and health. I'll stop there for now. Thank you.
Wonderful. Thank you so much, Michael. Next, representing the agriculture sector, I want to turn to Simon Ehui, Director General of the International Institute of Tropical Agriculture and Regional Director of Continental Africa at CGIAR.
Okay. I'm trying to put my video on. Are you able to? No.
Mm-hmm.
Okay.
We can see you, Simon.
Sorry. All right. I want to make sure that you hear me out very well. Correct? Yeah.
Yes, we can hear you.
All right. So let me, good morning, everyone. My name is Simeon Ehui, and I'm indeed Director General for IITA and Regional Director of CGIAR for Africa. And I want to, it's a pleasure to be here. Thank NAM, the National Academy of Medicine, for giving me the opportunity to be present here. So this presentation is about a critical and a timely agenda, integrating agriculture, health, and climate action. So these are not separate challenges. They are deeply interconnected. The way we grow our foods affect the health of our people and also the health of our planet. So at the CGIAR, and specifically through our work at the IITA, we are committed to breaking down silos. We believe that science can and must be harnessed to deliver solutions that address these three fronts together, because food systems are productive, resilient, and nutritious, and can also help us mitigate climate risk and support better public health outcomes. So you'll hear from us today about how we are advancing this integrated approach through partnerships, innovations, and inclusive actions across Africa. Because truly, with science, we can. In this slide, thank you for bringing it forward. We'll be addressing the strategic areas for transformative climate agenda. So to effectively integrate agriculture, health, and climate action, we must identify strategic entry points that can deliver cross-cutting impact. In this slide, we outline three critical areas where transformation can happen and the enabling condition needed to support them. First, on the left side, as you will see, we see health-centered food and nutrition security. This calls for a shift in our food systems from focusing solely on production of large quantities of calories to delivering nutritious, climate-smart diets. This means investing in the micronutrient-rich crops, aquatic foods, and food systems that are both resilient to climate change and capable of reducing malnutrition. Second, in the middle, we have One Health and occupational health as levers for climate adaptation. By embedding One Health principles, meaning addressing zoonotic diseases, antimicrobial resistance, and pesticide exposure into our climate adaptation plan, we can better protect both human and ecosystem health. This requires coordination across ministries, investment in early warning system, and supportive policy environments. And third, on the right, we look at health framing as a catalyst for public and political will. Framing action around human health, clean air, safe water, and better nutrition can resonate more deeply with public and decision makers. This can help us build coalitions, secure more research funding, and make health the guiding star for agricultural climate strategies. So together, these three pillars and the enabled actions that we're going to discuss later on, give us a roadmap of truly transformative change. Next slide. Yeah. So as we think about transforming food systems to serve both health and climate goals, we must be clear-eyed about the challenges, but also inspired by opportunities. On the left side in your screen, you will see the barriers that continue to constrain agricultural transformation. These include what we call the agricultural double bind. The sector is both a victim of climate change and a contributor to it. Chronic underinvestment, fragmented approaches, and limited access to innovation make it harder for farmers, especially smallholders, to thrive. These issues are compounded by knowledge gaps, infrastructure deficit, and persistent inequities. But on the right, we see the real change. We see the real change is possible. There are four opportunity clusters that can help us shift the paradigm. First one is regenerative resource stewardship, which is about restoring soils, water, and ecosystems so they can support life and livelihood sustainably. Second, climate smart production systems, which is about adopting practices that help farmers adapt to climate shocks while improving productivity and nutritious outcomes. Third, efficient and inclusive value chains, which is about ensuring that what is produced reaches markets fairly and profitably, especially for smallholders and women. Fourth, people-centered enablers, which is about strengthening local voices, improving access to finance, and building the policy framework needed to support transformation. So the message here is very clear. Agriculture does not just face the climate and health crisis, it can be a force to solving it. But it will also take integrated policies, inclusive financing, and bold leadership. So in conclusion, the integration of agriculture, health, and climate action is not only necessary, it's urgent. We have the science, the partnerships, and the tools to drive it. What we need now is the will, the political will, the financial capability, and collective action to break the silos and invest into integrated solutions. So our message is that let's reframe agriculture not as a sector for food production, but as a platform for human and planetary health, a platform that delivers resilience, equity, and dignity to millions. In CGIAR and in my institute, TA, we remain committed to this vision, working across disciplines, sectors, and borders to ensure that science works for the people and the planet. Because when we integrate, we amplify the impact. So again, with science, we can. Thank you. Over to you.
Thank you very much, Simeon. And finally, to close out this first part of our session, I'm going to turn to Rana Adib, Executive Director of REN 21, who's representing the energy sector with us today.
Yeah, thank you so much. And I'll be specific about it because I'm representing the energy sector, but I'm specifically representing the renewable energy sector. Why this? So maybe very quickly about REN 21. We are a global network of 120 institutions from governments, industry, science and academia, and NGOs dedicated to renewable energy. And why dedicated to renewable energy? Because it's very clear that energy is fundamental for our economies and societies. But we're operating in a fossil fuel-based environment that is has delivered a lot in terms of energy services. I think it's very clear that energy has a fundamental role to play, but it's also a problem for many of our economic, societal, security, and health issues and environmental issues. So on the next slide, just one number, and just from the health part, you see like air pollution, and there are many, many numbers, but air pollution is caused by fossil fuel, remains responsible for approximately 8.8 million deaths per year. Premature deaths. So there are different numbers depending on what we are looking at. I think in the current situation, it's obviously also really important to underline that fossil fuel is responsible for 75% of the CO2 emissions globally. So, and I think this has been really interesting because very often when we are speaking about energy from the renewable side, we look very much at the supply. Interestingly, and I think all the speakers before me representing the different sectors have really specifically looked at the energy consumption. And here, I think it's we already have like one aspect we need to bridge. On the next slide, I would just like to underline one part. The reality is fossil fuel is responsible for basically the health issues linked to energy. That's a reality. We know very much that we need to phase out fossil fuel, but here you see the numbers between 2012 and 2022. So, and even if you go back further, it's unfortunately not much better. We actually see that the share of fossil fuel in the energy we are consuming has been more or less stable, if you like, around 80%, let's say. Renewable energy has evolved a lot, and when we're looking, for instance, at solar photovoltaic, solar PV, we are tripling the installed capacities every 2 years. So there is also real exponential development. But what we can see here is that the energy demand is obviously also continuing to increase because we have developing countries that are still developing. The energy demand is increasing, industrialization is happening, etc. And for the moment, renewable energy is actually not yet covering not even the increasing energy demand. What does this slide actually show us? That to address climate change, but also really address the fossil fuel linked health issues, we can not only build up the new, clean, low impact renewables part. We clearly need to work on reducing our energy demand through energy saving and energy efficiency. So I was very excited to hear the reference from the building sector, specifically on the efficiency side. But it also means that we need to strategically phase out fossil fuel. And this is basically the challenge we are, the opportunity you have, but also the challenge we're encountering, because we're operating in a system where everything has actually been built around fossil fuel. Next slide, please. I would like to now show you very quickly, when we're looking at the renewable energy developments, and I think this is fully acknowledging that these transitions are not just happening. Even though renewable energy today is the least cost option for renewable energy supply, we see that we need the right policy and regulatory frameworks. And I think these policy and regulatory frameworks very often are disconnected of everything that is linked to air pollution and health. What is interesting to see is renewable energy has really grown up very much or developed very much in the power sector, so on electricity. But when we're looking at the energy consuming sectors, you see, like in electricity, we have approximately 30% of renewable energy. When we're looking, however, at the energy consuming sectors, you can see that the share of renewables is still very low. In industry, 16.8%. In the building sector, 15.9%. In transport, which is the sector that is lagging behind the most, but is 30% of the energy demand and 20% of CO2 emissions, approximately 4%. In agriculture, 15.4%. The importance here, why I'm underlining this, is these sectors really need to have targeted not only health and decarbonization strategies, but also real strategies to move away from the consumption of fossil fuel to renewable energy. And interestingly, you see basically that in the power sector that has been successful, 170 countries had a renewable energy target for power. When we're looking at economy-wide renewable targets, only 90 countries have basically targets. When we're looking at heating and cooling, which is in industry and in buildings, only 43, and in transport or on biofuels specifically, 49 and 46. So I think there's already one part that is important, is like really the policy attention in the energy consuming sectors that needs to be tackled. On the next slide, I think it's what is very clear is we need to basically address these things by driving a system change. And I think this is today it's clear we need to move from fossil fuel to renewable energy, but it's actually not enough to have a fuel switch approach. Very often from the energy side, we're looking on the, and you see it here on the integrated energy system, the renewables and infrastructure part. This is very often the focus. So the supply. We don't connect it directly to energy efficiency and saving and renewable energy demand. Then it's also very clear that we need the renewable-based economy. So we need to build this up in terms of resources, production, trade, distribution, and consumption of goods and services, but also finance. And I would like to pause on this part here. Finance today is actually not accounting for neither the costs nor the benefits of the different energy sources we have. We can basically, you can click through it. I'm not going to pause. It clearly means like society in a renewable-based economy has a key role to play. And I think this is where from the renewable side, we see key levers because we clearly see that citizens, population, city governments are very sensitive to basically the health topics. And there is an opportunity to drive the integrated climate and health, but also integrated energy transition by linking those narratives. And with regard to this, we need integrated policies, but we also need to have better science, I guess, and better data and evidence to really reflect the impacts, positive, so the benefits, but also negative impacts, so that decision makers can really have a holistic assessment, I think, of the energy choices we need to do. So messages here, let's work together to have basically increase our health metrics in our energy transition part, but also make sure that the energy fuel discussions are also reflected in the health discussion. So better data and bring this data together so that we can have more integrated narratives, and then very clearly bridging basically the energy consumption and consuming sector strategies on decarbonization and health together with the energy supply discussion. Thank you very much.
Thank you very much, Rana. And thank you to all our panelists for your opening comments. From here, we're going to transition into the follow-up discussion. And this discussion is intended to be dynamic and conversational, and I welcome each of the panelists to build on each other's remarks as we work our way through. And as we're transitioning to that discussion, I do want to encourage anyone who's joined us virtually to have a look at the live poll that was placed in the chat by Michelle. And from there, let me start with a question for Ommid. And again, welcome others to freely build on his response. So where do you see alignment between your sector's priorities and those of others in leveraging health as the catalyst for systems transformation? And how can these commonalities be harnessed for collective impact?
Yeah, that's a really good question, Chris. And when we listen to the different sectors' perspective, right? For example, Rana mentioned about renewable energy. Obviously, renewable energy and buildings, they have linkages. And the challenge is that, and that's the same with what Renee mentioned around the steel sector, right? And also Michael's points around transport. The point here is that if each of us, we try to do our own work in our silos, the difference that we can make would be very limited. And that's really important for us, all of us together, to present this together in the health sector. The important point that I want to mention is, if we look at transport, for example, transport can easily be linked with the renewable energy through buildings, right? So those are the elements, and it has health benefits for everyone included. From our point of view, I think looking at reducing emissions, reducing pollution, and then increasing resilience. If you look at it from this three angles, it is not, Michael mentioned briefly around whether certain viewpoints of the time may reduce attention to this matter. But if you look at it from business point of view and why this makes the right business sense for financial institutions like ourselves, we provide financing for different types of projects. And at the same time, for the actual end owner of the asset or operator of the asset, why it makes business sense, then it is very difficult to argue against, right? When something has a business reason. The other piece is around policies and incentives. How can we align the incentives of different players in the game so that they all move toward the same direction? The challenge sometimes is that the misalignment of incentives makes people, even if it makes a business sense, they don't pay attention to this. So I stop here, Chris. I'm happy to add more later.
Michael, welcome you.
Yeah, I think, one of the biggest areas that we need to pay attention here is on getting good quality appraisals of the full cost and cost internalization of decisions that are being made at every level in the investment chain by both large-scale institutions and individuals as they make choices. We live in a market economy where people are constantly making choices, but the choice sets are constantly being constrained at an institutional level, especially in the transport sector, but also in energy and buildings and the built environment where, we don't get to pick among everything. We have a constrained set of choices, but often we have incomplete information about what the implications of those choices is. In the transport sector, one of the things I've been pushing around and trying to challenge over the 40 years of my career is that the investment analysis tools that are used by transportation planning in the United States and many other countries systematically discount or ignore the health impacts of choices and systematically misstate the benefits of, for example, investing in building bigger, wider roads or new road systems. The computer transportation models that were developed in the mid-20th century ignore a phenomenon called induced demand, which is if you build a new road, for example, it tends to fill up with traffic within the next 5 or 10 years, and you end up 5 or 10 years later with the same travel time that you had before, the same congestion level you had before, but now you have more traffic as people take advantage of the fact that the generalized cost has gone down because there's been a public investment to expand capacity. That phenomena of if you build it, they will come and they will fill it happens around a variety of things. The Netherlands and many other countries have invested in bike networks that make it very easy, fast, and convenient for people to get around by bicycle. And so what's happened? Well, they have 30 or 40% of all trips in their cities by bicycle because they've invested in those networks. Whereas in America, we've invested in massive road systems and become ever more dependent on the car. And the appraisal tools that are being used, even to this day, have not been corrected to reflect the real implications of investment choices. So I think getting health information out of and reflected in the decision-making process is important, but we also have to make sure that the appraisal tools are honest and do full cost accounting, and then help to pass those costs through in a way that investors and consumers can see the benefits and the costs in an accurate way.
Go ahead, Rana. I saw you come off mute.
Yes, and maybe just to directly build on what Michael just said, I think from Rent One side, we have really put a lot of effort in bridging, for instance, the supply and demand side, in particular looking at renewable energy in transportation, for instance. And one of the things we have realized, it is indeed about the right planning tools. It is about a sectoral disconnect, but it also comes down to who is responsible for what. So, when we're looking in particular at the cost and benefits, I think this is basically a part which is very clear that even if you integrate the cost and the benefits in our planning tools, the ones paying for it or benefiting from it might be different one than the ones investing. And I think this is basically one of the big challenges, because there is to some extent, and I think it is interesting that we bring the data and the tools together to align policies, but that we also bring some transparency basically into who is benefiting from what, you see, whether, where do we have draggers and drivers and vested interests, because otherwise we will basically not crack these structural challenges. There is a structural inertia that comes from the fact that we are operating in an economy and in a society and in infrastructure that has been built around fossil fuel. That has been built with a certain world order, and where aspects like CO2 emissions and cost to climate change, resilience as benefits, etc., are not yet reflected in the economic system and the economic metrics we are operating in. So I think it's really important that we bring some transparency on that front. And then it's also very clear that all the things we're talking about are actually things that are economically beneficial when we're looking on a longer term. Unfortunately, we're operating basically still in economic markets where we're speaking about short-term benefits, and many of the companies will operate, even the governments will look into kind of 4 years where they are in place. And I think that's really one of the other joint topic, which is how do we basically bring real strategic planning and longer term assessment of the solutions to the forefront.
Thanks so much, Rana. I'm going to keep you on the hot seat and but transition or pivot a little bit in thinking about strategy, but more specifically, what immediate, and I'll ask this of you, Simeon, as well, and all our panelists, but I think the two of you can kick us off. What immediate cross-sector opportunities exist to amplify the role of health in driving climate action? And specifically, Rana, off your points, what partnership or mechanisms can accelerate that progress?
Was this question to him?
Yeah. If you wouldn't mind
Renee?
feeling it first, Rana. Yeah.
Oh, okay. Yes. Very happy to. Sorry, I thought that you. I didn't. I do think the first one is actually to create these spaces. It is very, like this is actually an excellent opportunity for all of us to come together, because you will very rarely see players from transferred agriculture, industry, buildings, and energy sitting in one room. See, I mean, this is the first part. So finding topics that are cross-sectoral, I guess, like health, is fundamental. So I think this is, it's a question of framing it. And then it's a question of building thought leadership by, I guess, like 10 to 15 good thought leaders and multipliers who are ready to engage in understanding how the different sectors operate, what the interests are, and really come up with good guidance, again, that is translated into sectoral guidance. So this is one part. The other one, and I think it was very interesting to see from the building side and the transfer side in particular, is the importance of subnational governments and city governments, actually. When we're speaking about health, they are much closer to the citizens. Air pollution is concentrated very often in urban environments, etc. And what we can see, and we observe similar things on the energy transition, is that city governments and subnational governments are often more ambitious than the national governments because they are directly concerned by it, and the cities are directly concerned. And I think in many countries, we actually see a disconnect between the subnational and national governments. So I think these are levers we need to bring together. And the third part, I guess, I would say, building on what Ommid said on the resilience part, I think it's really linking the societal and environmental benefits together, and health and climate, and not only about climate mitigation, but adaptation. Because when we're looking, and I think there is a lot of learning also of the COVID times, you see like the interruptions of supply chains, the discussions we're having currently on energy security, there is really something that is about the resilience of our solutions. And so resilience is definitely another topic that can bring some of the sectors together. When you look at resilience of economies and societies, it's very often about, what is it? It's food, water, energy, and transport to a large extent. So,
Thanks, Ryan. Simeon, I saw you come off mute.
Sure. Thank you very much. I'll come to the question on partnership, but before that, I just want to come back to the earlier question about the alignment between our sectors and others in leveraging the health as a catalyst for system transformation. First of all, I just want to mention that health is not just another impact area for climate. It is a powerful catalyst for climate action. And agriculture is often portrayed as part of the problem, but it is, actually a massive part of the solution. So by rethinking about how we want to grow food, how we want to raise animals and manage land, agriculture can drive the transformation process. I have several examples, but let me come to your question on partnership. So partnership are central to the CGIAR approach and engagement with stakeholders. We work with CGIAR centers, for example. The 15 centers work, with each other. We work with the national research systems. We work, for example, in Africa with African government. We work with regional organizations like ECOWAS, the ASARECA, which is the East Africa Regional Agricultural Research System. We work with the Forum for African Agricultural Research. We work with private sector NGOs, advanced research institutions, to bring the right actors together and align interest and co-create solutions that are impactful, inclusive, and resilient. Each of the partners plays a unique role, from science, and policy to scaling and delivery. The network of partnerships is operationalized through regional hubs. We have regional hubs, in Africa in this context, which provide a decentralized structure for tailored engagement and coordination. And then through the hubs, research output are connected directly with national priorities and local stakeholders, ensuring that innovations are relevant, scalable, and sustainable. In the face of climate change and low productivity, this collaborative model that we have is how we do to deliver real lasting change. Let me give you a good example, one which is funded by the African Development Bank. It's called the Technology for African Agricultural Transformation, which is a multi-partner initiative. And through that partnership, we have disseminated proven technologies across Africa. For example, we have deployed IRTA, bread cassava that's resistant to drought, and so on, maize and soybean varieties across over 30 countries, reaching millions of farmers and contributing to food security at scale. So the issue of partnership is, without partnership, I would say that none of the CGIAR Center will be able to operate. We take that one very seriously, and we need to be able to partner to be able to deliver, results at scale. So basically, this is, the key message I wanted to leave here on your question, about the role that our sector plays, and also how partnership plays the key role in addressing those questions. Thanks.
Thank you so much, Simeon. I want to key in on something you said early as it transitions into the next question that I have down here for you, which is, you talked about the how, and that was how you framed it. And I wanted to focus on that, not just because of our next question, but also because it's the topic of our next workshop coming up, which, as a shameless plug, we have open for registration. We'll make sure everyone gets that link soon. But moving on to our next question around the how, specifically around barriers. And I want to know from all of you, but specifically, I think we can start with Michael and Adina. What barriers, political, economic, social, or operational, must be addressed to fully harness health as a catalyst for achieving net zero emissions and equitable health outcomes?
I mean, I think that one of the barriers that we face right now is a lack of focus on an emerging right to a clean environment for future generations. And I think this is something that is an opportunity that we're seeing emerging in more and more places now, as an area of at times successful litigation. I was part of a lawsuit in Hawaii last year where 13 young people sued the State Department of Transportation and the governor for the failure to reduce greenhouse gases and traffic growth as part of the state's transportation program and policies. And we were about to go to trial in June of last year when we won a settlement agreement from the governor and the state DOT director, in which they agreed to put together a transport decarbonization plan for 2045 for the transport sector island-wide, with a 50% reduction by 2050, with implementation of their pedestrian and bicycle plan statewide in the next 5 years, something they dragged their feet on for decades. Restructuring how they go about selecting transportation projects and capital investments to take account of climate and traffic growth, and setting up a youth council and some other important reforms related to implementation of the settlement agreement. And that's one of a number of these growing number of lawsuits around the world in which the right to a clean environment for future generations is being recognized. In parallel with that, I think there are efforts to try and pursue a right to safe communities. There's a group called Families for Safer Streets that's been successful in a number of cities in advancing an agenda for making streets safe for vulnerable road users, pedestrians, and cyclists. And this group is formed of people who are victims of traffic violence or related to those victims, and can be very persuasive, even in a populist political environment, to fight for rights to health and safety, for healthy air. I think we've seen this in the air quality arena, and I think we can take a rights-based approach as a way to overcome many of the barriers that we now face for making progress on linking health to climate progress and to progress in a number of other sectors.
Yeah, and I would build on that. Rana actually made a comment in an earlier statement where she mentioned political cycles. Investment in business, especially if I'm just going to point to the steel sector, building a facility can take 8, 10, 12, 15 years, and you got to set that up, and you got to seek financing, and you got to get the technology, and you got to install it and test, and all of that takes time. But politicians want to see results in 2 or 4 years, and even investors want to see results pretty quickly. And sometimes that can be a barrier to seeking the financing you need or being able to deliver on the promises if you're seeking, let's say, tax credits from a municipality where you are trying to locate your new plant, or maybe you're upgrading, or you're trying to meet the promises that a politician made in an election cycle. That can be very, very difficult. And in terms of whether or not you were seeking a government subsidy for purposes of delivering on a systems change, or maybe it's in an existing facility for purposes of bringing down your emissions profile, and whether or not you're going to actually deliver on that promise, a politician can't wait for that 8, 10, 12 years. And so whether or not you're going to meet those promises. But I think there's also these questions about, what does decarbonization mean? What does net zero mean, such as was defined in the Paris Agreement? And how do you get there? And what often pops up, particularly in our industry, but I think it pops up in many industries, is unfortunately a marketing ploy, by many companies that are saying, yes, we're taking action to cut emissions. Look at us, we're so green. And so inevitably you get greenwashing. And you lose trust and the integrity of companies that really are taking action and really are delivering on the promises that you have made. And it starts to muddle whether or not there's success happening within these industries. We feel in our program that we have designed it in a way that we are building, that we are trying to cut out greenwashing. We're still a young organization, but we're starting to develop the data where emissions are actually being cut out of steelmaking process, so that we can edge out of the market those that are making false claims. But the more you see these claims being out there, the more that I have to work harder to overcome and rebuild trust and show that delivery, so that ultimately we can meet those promises that are being made and actually show that we are delivering on what we're being asked to do, and ultimately creating those positive health outcomes. And I do want to just also build in some just quick comments previously, on cross-sectoral partnership, because the steel industry is working very, very closely with renewable energy sectors in investing in building out renewable energy capacity. Because the steel sector requires a lot of energy to make steel, and particularly in the United States, but I think we're seeing it in Europe as well, there is some fierce competition for energy against data centers who will pay above market for energy. And so we're looking for energy wherever we can get it. And renewable is a huge opportunity for us, as well as nuclear. So having a mixed basket for that. We are also partnering with automakers, where we're not just thinking about tailpipe emissions, we also think about sustainably made vehicles, creates opportunities. And of course, in the construction sector, there's more and more sourcing of low emission steel that creates opportunities in the built environment as well. I just wanted to throw that out there as well while I had the floor.
Thank you very much, Adina, and thanks, Michael, for your earlier response. I am going to keep us on time because we are starting to see questions come in from the commissioners and audience, and they're fantastic. So I want to spend as much time as we can on them. I will say some of them are quite long, so I will read them out, and then I will ask one of my colleagues to post it in the chat, just so all of our panelists have the chance to dissect the many parts of the questions that each of them have. So kick us off from there. To all speakers, we in the health sector think health could be a compelling, effective framework for driving decarbonization. But we know that mainstream leaders and managers in each sector, heavy industry, transportation, et cetera, have other things on their minds. This is kind of what was just spoken to: productivity, profits, et cetera. What is your honest assessment? Does the health framework have the potential to motivate action in other sectors? Or do industry leaders think that it's just one of many nice-to-have considerations? Happy to repeat any of that, but again, we'll put it in the chat and open it up to our panelists.
I think it will matter if we get a high-level leadership focus that says it ought to matter. If we have leadership that says protecting human life should have primacy over moving cars faster, for example. I mean, that's a basic debate right now in traffic safety all over the world. I mean, in America, we tolerate the equivalent of an airplane crash a day in terms of lives lost. You know, a couple hundred people a day, it adds up to about 40,000 a year, and it's business as usual, and we kind of shrug it off. Whereas, you know, when a plane crashes, it's really a big deal. We change the culture around safety and plane crashes. We need to change the culture around safety and traffic, which will contribute to achieving climate goals if we can do that. And it may be that we're better off talking about changing the culture around tolerance of safety and road deaths than we are as a traction point than we are about saying, well, we have to do this for climate reasons. We need to do some of that too and change the culture around that. And that's where I think we make progress by trying to change the culture about creating a broadly shared set of rights to a clean environment for future generations.
A very quick part. I would say there is no black and white. And I would also say, like, we tend to turn to leadership, and I think political leadership is fundamental. But unfortunately, we are also living in times where the political leadership is partly missing on the long-term side. And as a result, I think we need to rather see, like, who is sensitive to the health story. So this is one part. What decision makers has health and health benefits on their own key performance indicators, so to say, political agenda. This is one part. And the other one is also, how do you actually translate some of the health benefits into benefits for decision makers? They might actually not have health on the forefront. And I'm going to bring two examples. One is three examples. When you look at health at the workforce, in the beginning, lots of companies were actually not very keen on starting to have standards whatsoever. At one point, they realized that it was an economic benefit and that ensuring basically safety at the workplace was also a way of attracting players. If you took a company, employees, and so on, and it became a direct economic and positioning benefit for companies. So I just think it's kind of how do you translate the health narrative into something that is relevant for your target audience. This is one part. The other one, and I think this is basically a part where I would say the players who are, I take two examples. We had in Europe here a full blackout in Spain and Portugal, you see, yesterday. 20 million people concerned by this. Economic impacts whatsoever. At the same time, we have 700 million people who just do not have access to electricity. And nobody really cares about it. And I think this actually shows that the political leadership is not enough. But if you bring it to those governments and say, like, it's an opportunity for you to invest, obviously, in energy access, but economic development, industrialization, real local benefits, etc., then basically the governments will basically pay another attention again to renewables. And here, I just think this situation has shown one of the really great opportunities between the health sector and the energy sector, which is the resilience of energy supply. Interestingly, hospitals obviously all had diesel gensets and very often also mini-grids, you see renewable-based mini-grids, to ensure that there was security or safety energy supply. And I think these are opportunities to connect some of the great stories in the health sector that is looking into decentralization to also align some of the interests. And it comes down again to energy security and resilience. But I think it's really about how to win the narrative, and we need to have a more differentiated approach to the different target audiences. Sorry, very long.
No, that was wonderful, Rana. I will ask Adina. I see you're coming off mute. I'm going to add a layer into this too as well. So feel free to answer the first question or the second questions. We've kind of been hovering around it, but I want to add this layer from one of our commissions. And so keeping in mind the first question. In addition to that, how do you fit a rights-based approach into a systems model that needs to account for and appreciate the need for financial returns in your sector? So this is specifically, I think, asking about the finance piece as well as what we've been talking about, those other benefits. So hopefully that didn't throw you off, Adina.
Yeah, I mean, well, sorry, just taking a second so I can consider the second question too. I mean, first of all, I don't think this is a universal value worldwide. I can really only speak for steel companies in the Americas and probably across Europe, but they would all tell you that their employees are their number one asset and their number one value. They can't operate without their people. The companies are members of their communities. Their people live in their communities. They believe 100% in health and safety, and they invest in it every day. And it really is their number one value. So they don't give lip service to health. They believe in it fully, and they invest in it fully. And I do believe that also means that they deliver, and it translates into financial returns as well. In different ways, you can interpret that in that they invest in their people, so their people come to work. Their work translates into productivity. Productivity translates into output. Output translates into financial return. But they also believe that, decarbonization means you're doing right by the environment, but that's also just good business because of the efficiency gains that comes out of that. So they really do believe in these things, not just because it returns on their dollar, because it's just good business to do right by society in all of the different ways that means.
Thank you, Adina. Anyone else?
If I may. you go ahead, I'll follow.
I just had a very, very quick question because one of the combination, not question, but comment on this. One of the common commodity, I guess, in the decarbonizing in health is the fact that we're using fossil fuel, and fossil fuel is still highly subsidized. You see, $11 million per minute. And this is actually one of the key levers that can already rebalance some of the economic assessments. And I think there are really great examples where we see that where energy prices are very high, and when you're looking at islands, for instance, decentralized regions, etc., and that need to import through, they are going to move directly to energy saving, efficiency, and renewable energy because it makes economic sense directly. So,
So go ahead, Simon.
Yes, Chris. Yeah, I think you asked, earlier a very important question. If health could actually be the access from which we can address the climate agenda. In my sector, in agriculture, if you actually look at it from the health viewpoint, you can actually see, the importance of connecting agriculture with health. So let's look at Africa, where we have our biggest focus. The production of agriculture depends on millions of smallholders. They have 1 or 2 hectares of land, producing, small-scale agriculture. A lot of them, most of them, are exposed to sun, and primarily women and children. Unlike, farmers in the US, where I am at this moment, who are actually cultivating with air-conditioned, trucks, combine harvesters, and things like that. So if you want to reduce, you want to increase productivity, and the policymakers see that the people actually producing the food are actually not healthy because of the amount of exposure that they have to sun or to heat, okay, and then reducing the productivity. Then therefore they are reducing the productivity of. Their health is impacting on the productivity of agriculture. So if you want healthy people, if you want to improve productivity, you want healthy people, right? So you can see the connection. So starting from the health side, you can actually, make a case for increasing productivity in order to have, healthy people. So for us, it's quite important. But the challenge is the following: what do we have? We have, despite the fact that 1/3, of the world supply, are also smallholders, the climate finance only reach 2% of these people. And so we are in a world where climate targets are missed. About 1.8 billion people will suffer from hunger because of that. So these are the kind of analysis we need to be able to make, connecting productivity agriculture with health. It's a virtuous circle. So your question is quite important. It's not just about productivity of agriculture; it's about health, and productivity. This ecosystem we need to look at. So
yeah. Thank you, Simeon. Thank you. Thank you for tying that back into our earlier key points. Michael, I saw you come off mute. I'm going to ask that if you do have a comment, that's the last one, because there's a couple more questions. One in particular that I want to kind of layer on top of this one, and I think we'll get some great responses to. But Michael, did you have one last comment?
Well, I was just responding, actually, just in the text box. I think we do need regulatory approaches to get these rights established, and we also have to eliminate subsidies for fossil fuels. All of that requires political work and leadership, and to get there, we need culture change to drive the leadership and political change.
Yeah, thank you, Mike. Great way to tie it up, and thank you again, Simeon, and to all our panelists. One last question, and it is a very broad one, a very short one, a quick one, but to you all, where does the growth of the circular economy fit into your thinking? Ommid?
Maybe I can start. And before I answer this, I just wanted to also add to the previous conversation very briefly that, having the human-centric mindset is critical, right? For example, when we look at our food systems, when the food systems are creating more health problems, and then we try to introduce more medicine to resolve the health problems that caused in the first place, is like building construction that is not human-centric, and then trying to retrofit that construction or add renewable or improve the resilience of those assets. One of the challenges we are seeing in our sector is that with increased impact, insurance sector is pulling out from different regions, and with no insurance, there is no finance, and if there's no finance, then homeowners would be in trouble, right? And financial sector would be in trouble, and that then can cascade to the point that the entire economy can be in trouble, right? So this is really a cascade that starts from a human, but it can translate to a collapse in an entire country's economy or loss of GDP. One of the other points, two examples, and I come to the circular economy. One is that in South Africa, we had a design for housing that would save 1 month of rent for a homeowner per year. And those homeowners, they would also access lower interest rate mortgage because their homes were more energy efficient. So imagine you're a low-income family living in South Africa, having 1 month of your rent saved for a year, and you're paying less for your financing, right? In those situations where then you can spend that for your children's education or for something else. Coming back to your point about circular economy, building sector is one of the largest sectors of waste generation. And one of the worst situations are here in the US, unfortunately. If you look at the way that buildings are destroyed, you see the building with the entire windows and doors and steel and everything gets destroyed, and everything goes to landfill. I don't see them reusing that system. The challenge is going back to the competition between the recycled materials and virgin materials. The steel sector probably is one of the best ones, Adina, because you have a lot of recycled content in the steel sector. But if you look at cement, or if you look at aluminum, is also good because it gets a lot of recycling. But I think if we look at it from the job creation point of view, we talk about job creation in the US. We say that we need to bring industries back to US, but we can create jobs with a circular economy right here. The problem is that if you are putting the incentives in a sense that then it disfavors recycled elements to virgin materials, then obviously you're killing that industry altogether, right? So it's really important for us to going back to the policy and regulations, how our policy and regulations can support. We had a project in Monterrey, Mexico, where the cement industry, they pull all the construction waste and then reuse it in their cement and concrete production to build buildings with that recycled content. And that's, from technology point of view, it's possible. How can we build that into the processes that then brings the profit as well? We don't want something to be a negative profit for any industry, right? It needs to be positive for the worker, positive for the business owner, positive for the builder, positive for the contractor. And that's where alignment of incentives can support our transition for a circular economy or for health and human-centric economy and design.
Thank you, Ommid. Thank you for your expertise. Adina, I think I saw you come off mute.
Yeah, no, thank you. Thank you so much, whoever answered the question, because this question always gets to my heart. This is a particular expertise and interest of mine, and has been for a long time. I've been in different capacities, but steel is indeed the most recyclable commodity in the world. And over 70% of steel made in the United States is through the circular electric arc furnace route, which is why the US has the lowest carbon footprint steel made in the world, is the second lowest carbon footprint steel made in the world. First only, I think, after either Italy or Turkey, one of them has a lower carbon footprint, but using the same circular process. There's two main reasons why circular economy is so successful in the United States, not just for steel, but for aluminum and a couple of other commodities. And this is a lesson for the rest of the world. Number one is because we do not categorize materials as waste. We recognize that materials that are recyclable are considered recyclable materials or recycled materials. That W word is reserved for materials that are bound for landfill. And this is an important distinction, and this is where the failures are found in other parts of the world, is when you call something waste and you treat it like waste, then you have confusions about whether or not it goes into a manufacturing process or not. And that's, in my personal opinion, not on behalf of my organization, in my personal opinion, is why recycling in the circular economy does not actually function very well in other parts of the world. And the second reason is because, especially in steel, is that the circular economy is indeed a very closed loop because of the market pull. There is a demand. There are manufacturers that want those recyclable materials, and it goes back into manufacturing. Only now in Europe are we going to actually see the circle of a circular economy close for the very first time in history because of the ESPR, the ESPR, the Eco Design for Sustainable Product Regulation. Well, we'll see if it succeeds when it becomes implemented as designed. But up until this point, we really never saw the circular economy close in full loop because you never saw that demand pull, partly because of this idea that that materials that could be recycled were called waste, but also because so much of those materials really went into incineration. So that's why circular economy can be or realization is if you don't think about it in this waste paradigm, and if you create the conditions, whether it's market driven as it is in the United States, or you have good regulation as hopefully becomes realized through this ESPR in Europe, that with the understanding that you need to have it be very demand driven.
Thank you, Adina. Maybe time for one more on this if anyone has anything they want to add. If not, I have a great question to bring us home and circle it back. But Simeon, go ahead.
Yeah, just briefly, just to few word on the circular economy and what we do in the CGIAR in agriculture. So for example, we strongly believe in that. Our research on soil, for example, encourages recycling of crop residues and animal manure to improve soil fertility. This is, for example, a good way to reduce the use of synthetic fertilizers. This is good. And then we also have agroecological, practices like intercropping, agroforestry that we promote, which enhance biodiversity, improve soil health. Biogas is also another area that we are working. Biogas and organic fertilizer, which exemplify basically the waste to value approach. So through research, we at the CGIAR we promote sustainable resource management by focusing on waste reduction, nutrient cycling, and the recycling of agricultural byproduct such as crop residues, animal manure, and valuable resources. And this is an agenda that's very high at the level of policymakers. Recently, when I was talking with the cabinet in Côte d'Ivoire, the prime minister asked me to support them in really enhancing their work on circular economy. Côte d'Ivoire is, for example, the first producer of cocoa, and they want to see how, in addition to producing the cocoa beans for chocolate, they could use the waste, from the cocoa to do, other activities, like, for example, energy, or, even doing paper, things like that. So it is an area that we are focused on. For us, it's quite important. So, and also turning, some of this manure into compost, into energy, is also another area we're focusing. So it's a major area of our focus. But for us, circular economy is quite important. That's what I wanted to add. Thank you.
Thank you, Simeon. So about 4 minutes left. So look for quick answers for this question. It's directed specifically at you, Michael, but I'll ask others to maybe highlight some items in your field or in your sector that you think are relevant. So for Michael and all, but specifically for Michael, in your closing bullets, you noted the importance of surveillance. Might you provide examples of cities doing this? Examples of health metrics that are being used to understand the health impacts of transportation system changes, et cetera? How are health departments engaged in this measurement?
Yeah, I think this is an area where I think the most widespread approach has been under the Clean Air Act in the United States, tying transportation policy investment decisions to conformity to state air quality plans. And this has been done over a period of several decades successfully. With regard to other more broad health impacts, the city and county of San Francisco have been doing some very effective work in this area with health impact assessment on transportation planning and decision making. I think there are some other jurisdictions as well doing that, but those are two things I'd point out.
Thank you, Michael. Anyone else add? Rana, see, come up here.
So yes, basically, I don't have a direct response to the metrics. I think that there is, I would say that from the energy transition side, you see, very often we're actually focusing more on decarbonization, energy planning, etc., and we're not specifically looking at, you see, the Clean Air Act and the air pollution policy processes, etc., to make the energy efficiency and renewable energy solutions visible and relevant in those discussions. So I think here it is not so much about new metrics, but it's about taking those metrics to translate them for a different type of decision makers and changing the narratives. Now, when you're looking into some countries and cities that have been really leading on renewable energy, and we see California, San Francisco are part of it, but it's when you're looking at China, it has been very much driven by Chinese air pollution at the local level. This is something that is fundamental. Even when you're looking at Korea, you see like it is at the city level. When you're looking at India, we see that the local air pollution is actually a key driver for the energy transition. And so I think it is probably how to bring some of the health metrics into some of the energy planning decision tools. And ultimately, it comes down by an assessment of the cost.
Thank you, Rana. Any others from the panel? Final thoughts on this?
Chris, one thing that I want to add here is that sometimes, in building sector, there's something called value engineering. And what value engineering means in building sector means that when you design a building, at some point toward the end of the design finished, and someone comes in with the value engineering glasses and looks at the project and starts cutting down things out of it, right? For example, if there's a requirement for recycled steel, they can cut it out. Or if there's a requirement for shading, they can cut it out. Or if there's a requirement for a specific type of design, they can cut it out. Why they cut it out? Because their perspective is, okay, this design costs me $10 million. I'm going to cut 1 million out of it. So there would be a 1 million savings, right? That's how they see it. But from the long-term life cycle operation of that building, those cuts may be negative for operation of the building. But if you also then expand that to the larger societal challenge that those cuts generates, for example, what jobs you are cutting by cutting those elements, what kind of health and negative impacts you are creating by cutting those elements, that perspective is not there, right? So what happens is that then you're cutting it based on your silo, but if you add all these buildings that are inefficient, they are not resilient, they are not good for infrastructure of the city, then you add up all these problems together, you have a city that is inefficient, you need to serve it with infrastructure, and you have people that are getting sick or having problems. So changing the perspective of businesses or providing incentives so that they don't cut these elements based on or mandating it, so finding some way that the silos gets broken, that would be important.
Thank you, Ommid. And thank you again to all. Oh, Rana, I don't want to cut you off. Go ahead.
No, just I think what you brought up, Ommid, is reminding me of a really great story of Octopus Energy. They have a business model, so it's an renewable energy company and utility in the UK that is also internationally active. They have partnered with housing loan player, and they are basically including in the housing loan that you can basically all the energy efficiency investment, energy efficiency and renewable energy investment will lead to the fact that after 10 years you will not pay for your energy bill anymore. It's already included basically in the housing loan. And what I just thought is it's probably really interesting for the health sector to identify some of these great business models and partnerships and bring the health story there, because what we really realize is it's ultimately health is something that is really close to citizens, people, parents, grandparents, and so on. And I think it is a way to really also create the pressure on our governments, making them aware of this is so sustainable housing and sustainable buildings is not only something that is reflected on your energy bill, but it's also leading to better health situations for your families and changing basically the narratives around this. And then we can have this, we can have connected buildings to public transportation so that you also have healthy cities and so on. I think there is a really great narrative to tell from the different sectors. All right.
Perfect, Ron. Thank you. Perfect way to end this part of the session today. So again, thank you all for the wonderful questions and that you asked of our panelists. We have a lot of them still left in the queue. We'll make sure we get those answered offline. And again, just thank you. So to close us out, I'm going to ask each of the panelists for one closing recommendation for the Roadmap Commission. And it's in response to this prompt, which we can put in the chat again if you need a second to think about it or need me to repeat anything, I'm happy to do that. So here it is. Looking forward, how can the Roadmap Initiative best support and scale the strategic use of health as a driver for sustained systems transformation across sectors? And I trust each of you to come off mute when you want, and then we'll just make sure that everyone gets a chance to answer. But if no one does, then we can select them. So maybe we can then go left to right on my screen. Michael, are you ready to respond to that question? I'm happy to repeat it if you wish.
Sure, I'll do my best. I guess, I think getting the metrics under a bright spotlight, to me, is the best place to start. Transportation decisions are made by so many different actors at different time scales. different spatial scales, and getting a wider recognition of the implications of decisions for health, to me, is the fundamental place to start and ground conversations about this. So spotlighting the metrics, improving the quality of the metrics would be my answer.
Thank you, Michael. Rana?
I'll build on the metrics, because I think metrics are important. But you see all our reports. We're reporting on the development of renewable energy since 20 years, and we recognize that great reports in the background is not enough if you don't translate it into narratives and specifically targeting basically decision makers too. And I think this is really something where it is important that we have the narratives and that we invest some time. I think very often we experts are not the best to translate the narrative. So I would say, like, let's work together with some communication agencies. Probably having something, it would be really great to have kind of a 2-day workshop where we bring these sectors together, we bring our metrics together, we have some comms experts to see, and we try to see, like, okay, who are we trying to reach and how do we actually develop strong narratives for the decision makers in the health sectors, but also in the energy producing and consuming sectors, because I think ultimately this is a part. And then coming from Region 1, I just need to say, bringing the discussion of the energy transition, so fossil fuel phase out, energy saving, energy efficiency, and renewable energy to all sectors, but also to the health debate, because I think it is still not very visible.
Thank you, Ron. My roadmap colleagues were nodding vigorously as you were making those points. So thank you for making them. Ommid, Adina, Simeon. Simeon, go ahead.
Okay. Yeah. Okay. So let me say that from the perspective of the CGIAR, I think I want to say that restate that CGIAR aims to drive science, innovation, and collaboration to transform full land and water system for a climate resilient, net zero, and equitable future. So basically, through our more resilient, low emission farms, landscape and aquatic system, we will advance research across agri-food system, benefiting about, I can call it between 38 million vulnerable small-scale producers, and value chain actors across 30 countries. CGIAR launched a climate action program that's focused on strengthening the climate resilience of over 600 smaller farmers in Africa, Latin America, and yes, Africa, Asia, Latin America, using the One Health approach and taking considerable consideration of gender issues. I mentioned earlier that globally, a third of greenhouse gas emission comes from agriculture, forestry, and land use. Yet, agriculture can provide a solution to this, greenhouse gas emission. Smallholder farmers, who provide 1/3 of the world food supply, are also the ones who are greatly affected, by the impact of climate change, including health risks. So, despite this, the climate finance can only reach up to 2% only of these smallholder farmers. So, in a world where climate targets are missed, we are talking about 1.8 billion people that will suffer from hunger. So our program offers two key pathways to addressing the challenges brought by climate change by focusing on, number one, on driving policy and investment to climate finance to allow scaling innovation to millions of smallholder farmers, and two, implementation of locally led action. So for us, the health issue cannot be divorced from the productivity. It's a circle. If you don't have healthy people, you have low productivity. And if you have low productivity, you have low economic growth. And then if you have no economic growth, you have poverty. So everything connects. So let me end here to say that the roadmap initiative can, best support and scale the strategic use of health as driver for some system through agriculture. This is what I want to leave you with a message. Thank you.
Thank you. Thank you so much for all those thoughts and that message, Simeon. Before I turn it over to Ommid and Adina, I do just want to remind everyone, for those of you in the audience, there is a poll on Slido that asks a version of this question. We're really looking to get informations and considerations and directions to go to, not just from the panelists, but from everyone involved today. So please ask that you take a minute and fill that out. And while you do, Ommid, Adina, either of you want to?
I can go very fast in terms of the building sector. So what I would say is that, if we are gonna build any new facility, that facility needs to be efficient and resilient. That we cannot be adding more buildings that are inefficient and not resilient anymore. So that's need to be on the roadmap as one of the guidance for health sector, that any new facility, warehouse, hospital, clinic, pharmacy, whatever we do, industrial building needs to be resilient and efficient. The second element that I would say is that we have to, in the roadmap, if we can come up with ways that we influence the policymakers to support us in this transition, that would be really important. I stop here. The finance sector as well, because we are part of the finance sector, we take it for granted, but many financiers, they don't really pay attention to this. This is really important.
And I would second Rana's suggestion for communications is important. As I noted earlier, the companies really are hyper-focused on health and safety for sure of their employees as their number one asset. But they certainly do have also regulatory obligations already that they're focused on when it comes to ensuring the health and safety of their employees. And so I think if they have another group coming at them with ideas on health, they may feel more threatened than rather the more what I want to say, the more offer of partnership that is intended by the commission. So being very thoughtful about how we think about how we're communicating really the altruistic nature of what we're trying to achieve here, I think is really, really important. So, because I know it's really all good intentions here, being accomplished here.
Yeah, what a wonderful way to cap us off, Adina. Thank you so much. Thank you to all our panelists. I know Jonathan's going to provide some thanks, so I won't go too much into details. But so from here, Jonathan, I'll turn it over to you.